Aye. Aye.
Aye.
Great. Okay, motion passes. Jared, do we have any public comments? I don't think we have too many people on besides RAC members.
Madam Chair, we do have some people who are online who are not RAC members. So I'll just ask if anyone who's online who would like to provide public comment to please use the raise hand function within Microsoft Teams to let us know. In the meantime, Madam Chair, I'll just let you know that we did not receive any advance requests for public comment, and we did not receive any written public comment that we would have submitted to the committee members in advance of this meeting. And as I've gone through that spiel, I do not see any hands raised online, so I think we can move forward at your discretion.
Great, thank you. Number 5 is action items, and at this point, I don't think we have any action items. So we'll move to number 6, which is information items. And our presentation, we were supposed to have 2, but one person couldn't make it. So we're going to have a presentation about the area, that Pikes Peak Area Agency Family Caregiver Program. And I think that Lucy Crandall is going to do that. And if she could introduce herself and go ahead.
And so, Madam Chair, this is Melissa.
Mhm.
I see Kent is on. Lucy reached
here.
out to me this morning at 9. Is Lucy
I'm
here?
Huh?
Oh, good.
I was just an hour early, Melissa. That was the problem.
I know, but then I was kind of trying to scroll through the attendees and making sure that you were in there, but it's hard for me to scroll through. So anyway, welcome, Lucy. Thank you. All right.
Thank you.
And is Lucy the person who is to make the presentation?
Yes.
Okay, why don't you go ahead then?
All right. So I'm Lucy Crandall, and yes, the new supervisor of the Family Caregiver Support Center. And so while I'm the new supervisor, I am certainly not new to the Family Caregiver Support Center or the Area Agency on Aging. So I have been working in the Family Caregiver Support Center under Kent for the last year and a couple of months. So very familiar with everything that we're doing and everything that Kent has built. I also sat on the RAC actually for about 6.5 years. I don't know, I think it was about 6.5 years ago, but got kicked off because I had completed all my terms and had to take a break. So anyway, I'm familiar with everything that the RAC does. And I've been serving seniors, older adults, for 25 plus years. My background is in home care and resources. I published the Seniors Blue Book for about 12 years in 3 different parts of Colorado, but it certainly opened my eyes to the multitude of resources out there and really helped me develop relationships with those resources. So it's been pretty helpful in this role as well. And I don't know, for those of you that know Kent, you probably would not be surprised to hear how very smooth and easily the training and transition has been going. So we've been working at it since July 8th, and Kent has such a strong foundation to this program and such immaculate and detailed reporting that like handing over the reins became like much more seamless than I thought it was going to be. So it's really been a pleasant, I don't know if it's a surprise because it's Kent and I would expect nothing else. But anyway, he has the program very well set up, which makes it very easy for me. And I don't know if you guys have heard these statistics, but I'm going to throw them out there because Kent needs to get all the accolades he can get for this. So we offer a respite voucher through the Family Caregiver Support Center, and we're able to offer some free care to our family caregivers that are just burnout, need that break, or whatever they need it for. And so in the 17 years that Kent has been doing this and providing those respite vouchers, he's provided over 68,000 hours of care to the tune of over $1.2 million. And when I read that statistic, it still gives me chills. It hit very hard and strong the ginormous shoes I'm filling. And so while I really don't have big grandiose plans for what's going forward, we're just going to continue the great work that Kent has established for us to continue, because it truly is great and amazing work that we're able to do out of the Family Caregiver Support Center. So that's really my big goal. I want to get a new person onboarded to take over the extra 20 hours, or not extra, the 20 hours that I'm vacating. And then from there, it's really just getting our workings together, getting us solidified as a team. And then from there, my hope is to next year do a little expansion of our education and support that we are already providing. And also just continuing some outreach. It's one of the things that I'm good at is outreach and relationships. So I definitely want to keep the community remembering all that we do at the Family Caregiver Support Center. And, just keep our relationships with all of our providers and all of that stuff that, Kent's been so good at. So really, that's my story in a nutshell. I'm super excited to be able to do this. I'm honored and humbled because I've had a lot of support from our providers and from the community. So, I feel very confident in the continued success of the program, and, hope I'm going to do a good job for everyone. So anyway, that's me. Love to answer questions if you have them.
Maria, I see your hand is raised.
Yes, thank you so much. Hi, Luke. This is Maria with the Independence Center. Does your family caregiver program, is it like a supplement to other family caregiver programs, or is it its own standalone program?
Yep, it's its own standalone program. I think it was developed by Kent's predecessor, Patty Ozier, but Kent really, like I said, took the reins and developed it into what it's become, and with the respite voucher program and all of that. So yeah, we're a standalone, and thank you for asking.
Yeah, thank you. And sorry, I have one more follow-up question. For the respite voucher, is that only for your caregivers, or is that open to other caregivers in the community?
It's open to other caregivers in the community. They just have to meet the Area Agency on Aging criteria, which is to be 60 and older.
Jody.
And then their care recipient has to meet some ADL criteria and things like that. But there's not a lot of other criteria other than them being 60, somebody in the equation being 60 and older, and then their care recipient meeting a couple of ADL criteria.
Awesome. Thank you so much.
Yeah.
The Family Caregiver Support
Have a question?
program is a little bit different across each region and across each AAA. We're actually pretty well recognized for the way that our program is managed. A lot of that, as Lucy has duly noted, is certainly based on how Patty Ozier worked through that many years ago, and then as Kent has over the last about 17 years. And so the Family Caregiver Support is part of the Older Americans Act, and so therefore part of our, as well as part of our funding as well. And so it is strongly recognized as a necessary program related to the Older Americans Act, and is actually kind of being pulled out as part of discussion as Congress looks at our funding. It is one of those areas of programs and funding that is being highlighted as necessary to make sure people can stay at home safely and as healthy. And so we're really excited about the way this program is run in our community. Like I mentioned, it's very well recognized across the state and even across the nation. And people call into our office seeking advice or recommendations on how to expand or make their own program better. So we're really proud of that fact. So as mentioned, with Kent's retirement, coming up. Lucy's stepping into some big shoes, but she has a wealth of knowledge and a great background to be able to take this on. So we're really excited for this change in our program. So
I've been bragging about Kent's program across the state for 12 years because people are starting now. There's a few agencies now that, are sort of doing some similar things, but people were amazed. I mean, other area agencies on aging across the state were amazed that Kent was able to do what he was able to do with the funding given. And so, I mean, we've been talked about across the state for a long time. So it's, like I said, quite an honor to be sitting in the chair now. So
Melissa, I think Debbie is frozen, so I'll go ahead and recognize you with your hand up.
Hey, thanks. So I do have three other things I would like for Lucy to touch on. One is the caregiver pampering day that happens. And I know that it's not necessarily just a PPAAA thing by any stretch, but I do feel that it's been something that our organization has kind of been a lead on for a long, long time. So to talk a little bit about that, I don't know if everyone on the RAC is aware that that event goes on. And then second, the library that has recently, well, I don't know if it's recent, but that we have a lending library to talk about that a little bit. And then the third piece is just, and actually I'll leave the third piece off, I think. So if you could just talk a little bit about those two things, that would be really helpful, I think.
Okay. So Caregiver Pampering Day, again, something that I believe Kent developed. And it's just really a day off for our caregivers. So in conjunction with a lot of support from community volunteers and agencies and companies that sponsor the event, we're able to provide a nice day off for our caregivers. And we can offer, we do a little continental breakfast. We have a keynote speaker. I don't know how to mute my phone, but it's ringing, sorry. So our Kent's been doing this for so long. I'd never like to say an event runs itself, but this is a finely tuned vehicle. Our biggest bump in the road this year was the senior center being under construction, and we had to find a new location. But we're able to provide 60 to 100 caregivers, like I said, a day off with different, so to speak, everything from Take 5, give yourself a break, to juggling, which was one of our most popular sessions this time around. Because if you've never tried juggling, try juggling and think about work for a minute. You can't do it. So we really try to provide some kind of a break. We do a nice lunch for them, give them a little baggie of goodies. And we can even provide some respite care to their care recipient if their care recipient can't be left alone. So we really give them no excuse not to attend and come and be pampered and taken care of for the day and enjoy that day off. So that's Caregiver Pampering Day. It's in the spring, usually in April.
Is now
Sorry?
joining.
Oh, sorry. So it's usually in April. And so actually, I think our planning for that will be starting here in the next month or two. I'll have to verify that with Kent on my final training day. And then, yes, we have a pretty amazing lending library. It typically sits towards the back of the office, near Kent's office. But we have all kinds of books on caregiving, all kinds of different caregiving topics, from the mechanics of caregiving to the emotional parts of caregiving to, I don't know, everything in between. So we're happy to lend those out and let folks get some extra education in ways that they can digest it. Some of them are even like workbooks where they, kind of go through and do different exercises and things. So, but along those lines, I'll also mention that we do a 6-week class for caregivers. And what I love about it is a lot of those caregivers come into this class thinking they're going to learn the mechanics of caregiving and, how to give a bath and how to transfer people. And it's really more about how to take care of themselves, how to communicate with their loved ones, communication strategies to get their care recipients to do the things they need them to do without, difficulty. And it's a 6-week class, hour and a half each time, but it really does. I think it gives, they talk about 32 different tools to just help caregivers be better caregivers. And a lot of that are self-care tools. One of the statistics I like to throw out all the time, 63% of caregivers die before their care recipients. It's a pretty big number. And it's because they put their own healthcare off. So we try to help them not do that and be the best caregivers they can be through that powerful tools for caregiving class.
Bill,
Any
we see
tell-
your hand is raised.
Hit the wrong button here. Wondering what kind of coverage we have up in the east western part in Teller County.
So I didn't on any of that because it was very broken up and, you know, can you try repeating that for me?
That's one of the hazards of living in the mountains.
Much better now.
Wondering what kind of coverage we were going to get up in the western side in Park and Teller County.
Well, my understanding is that both the Teller Senior Coalition and the Park County Senior Coalition, sorry if I got those wrong, they both get their own sort of chunk of the family caregiving pot. And Jody will correct me, I'm sure, when I blow this, but to be able to dole that out in the ways that those counties need that, because you guys have such a very different service delivery, you know, capabilities and all of that kind of stuff. So I don't know, Jody probably can tell you more on that one, but that's my understanding.
Okay.
Yeah, thank you, Lucy. It just looks different, primarily across the other two counties, because of the limitations of services. But there are similar services, just not quite to the extent that we're able to do in El Paso County, because of agencies that are here already. Maria, I see your hand is raised next. I'm not sure where Debbie has gone, so I'll step in for the moment and hope Debbie can resume with us. But Maria, go ahead, and then I have a comment after you.
Thank you. This is Maria again, and I was just wondering, for the lending library, how long can people use a book or a workbook, and is there a limit to the amount of items they can check out at a time?
You know, no one's ever that I've seen been that quite enthusiastic about it. So my guess is if you want to consume some information, we are happy for you to consume it and, you know, kind of use it for as long as you need. Some books we do have multiple copies of, and so, you know, the length of time isn't as worrisome. Other ones that we have fewer copies of, you know, it may be more worrisome, but I am sure that we would work with any individual for their particular needs to get them what they want. You know, I'm never going to tell them, I'm not going to ever be the library police and call them and say, I need your book back. So just FYI.
Awesome. Thank you. We have a lot of caregivers we work with, so I'm going to push this out and see if this, this helps build up the usage.
Awesome.
Yeah.
Send them our way. Yes.
The other idea too, Maria, is that you could come when we reopen. You would be welcome, or someone from your staff who oversees that program would be welcome to come and peruse the titles that we have, and possibly build out, get some ideas for building out a library there at your office. So you'd be welcome to set a time with Lucy to come and take a look at the titles. And like she said, we do have multiples. We also have local authors who've written about either their caregiver experiences or some of the science around caregiving. You know, when we think about mental and emotional and the social aspects of caregiving, it's really quite a broad range of titles and overall books that are available. So you'd be most welcome to come by and visit. What I wanted to mention here is the Caregiver Pampering Day is probably one of the most sought out programs when it comes to information from our aging network, both across the state and nationally. Family caregiver programs are not unusual through AAAs, as I mentioned, because it is an Older Americans Act program. They are found. They just look very different. And so I think what really sets us apart is the Family Caregiver Pampering Day, because it's not just about pampering and focusing on the caregiver themselves and giving them that day off, as Lucy mentioned. The beauty of this is truly a community coming together to support our family caregivers. It's really an amazing program that is not just about sponsors, but about what you would typically consider agencies that are in competition with one another. And that's something that the Colorado Springs community around caregiving and aging services has really set itself years by coming together for the betterment of our older adults and their families. And so we're really proud of that fact that it's at any given Family Caregiver Pampering Day and the planning that goes into it. It's a dozen or more competing agencies, and they come together for this planning. It's easily a 6-month long planning time. Then the day before with decorating, the day of with producing that day and supporting our family caregivers really makes it a special program, because on any other day, they're competitors in the community seeking out those seeking out the ability to provide those services across the region. So it's just really exciting to see our community come together to put on this beautiful event that really does affect our caregivers in such long-lasting ways. It helps them understand how to take care of themselves, how to there have been cooking classes, the juggling class, like Lucy mentioned. There have been just some really neat opportunities for folks who have effectively been sequestered at home or in the environment of that care recipient in such a way that they forget to take care of themselves. And this is a really great opportunity to find out how simple it can be to take care of oneself and to make sure that they're healthy in order to provide for that care recipient. So the Caregiver Pampering Day has just become a very widely known event put on by the Pikes Peak Area Agency on Aging, the Family Caregiver Support Center specifically. So thanks for that. Melissa, I see your hand is raised.
Yeah, I just want to reiterate, kind of like what you're doing too, just the library and the resources that are available in that space are really very helpful. So just want to reiterate that again for the people who are on the call today, if you have a family caregiver who's just really struggling, and there's a book just right there here at our space. Of course, we have to be open again mid-September. So just want to reiterate that. And so maybe with that, if nobody else has any other comments, I'm not sure if Debbie got back on or not. So you might be.
Can you hear me?
Oh, good. Good. She's back.
I'm just on the phone. I keep getting knocked off on my Zoom meeting, through my computer. So I am just on my phone. I tried to do that a couple of times, but now I'm back on the phone, so I can't see anybody. I can't see if any hands are raised, but I am hearing everybody. Thank you.
All right. Well, congratulations,
Debbie.
Between you and Jody. Take it away.
So, do you have the agenda in front of you, or would you like me to carry on?
No, I do have the agenda, and I think, are we done with Lucy's review of the Family Caregiver Program?
I believe so. Any last questions for Lucy or other staff? I don't see any other. Oh, we have Jen has her hand up. Go ahead, Jen.
Just want to congratulate Lucy on the new position and excited for all the enthusiasm, excitement, and experience that she's going to bring to the role. And thank Kent for such a wonderful program that he has built over the years. It's been such a joy for us to have Kent in our community for as long as we've had.
Yes. We finally stopped crying
Thank you.
after the first week of our training and we were able to get through things, but I can see it's going to be another tear fest for about a week. So anyway,
No,
thanks, Ken.
I'm on that one with you.
Thanks, Jen.
Yeah, so let's I tell you what, let me grab this real quick. If you haven't seen the flyer yet, we'll make sure that goes out again. So next Wednesday, that's the 31st, we will be hosting a retirement party at Kinship Landing, which is over in the downtown area at 415 South Nevada from 4 to 6. Again, that's next Wednesday, July 31st. We're hosting a retirement open house for Kinship Landing at 415 South Nevada. You are most welcome to come, and we invite you to come and visit with Kent and staff. And of course, Lucy, as she steps into this new role, we're very excited for that and for the agency. Thank you for throwing that flyer up. So we just want to make sure Kent has a good taste of how much he'll be missed. So everyone is welcome. Please come. Let's pack the room. So, all right.
And I just
well, go ahead.
I just want to add that I think I met Lucy at one of the senior fairs that was occurring. I think it was the Gazette one. I think, Lucy, I met you at that. So it's great to have you on board as well in this new role.
Thank you. Yes, I'm very excited, and hopefully when we're all back in person, I'll drop into the RAC meetings on occasion so we have a face-to-face so I can meet everybody.
Super.
So thank you for all the support, and thank you.
Yeah, we're really excited to have Lucy on. She's been in the part-time role about 14 months, and she goes way back in the community and really has a strong grasp of the supports and services across the region. Great ideas. Really works well with our families and caregivers as she helps them work out solutions. So really exciting that we had someone kind of in our back pocket, as it were, ready to step into Kent's role. She had to go through a vigorous interview process, but we're glad she was the top choice. So that's really awesome. So Lucy, no pressure. You're gonna do great. You're gonna do great. So okay. All right. Well, looks like thank you for your presentation. If anyone has any questions, you know how it is. As soon as you hang up from the meeting, you're going to have 2 or 3 questions. Just reach out to any of us here on staff. We're happy to get answers for you. So moving on to 6B is a membership subcommittee. Maria, do we have any updates?
Hi, this is Maria. We do not. I'm trying to do a push right now with the area resource groups to drum up participation, see if anyone is interested in joining the RAC.
Awesome. Thank you. Thank you for that. Next item, 6. Oh, go ahead, Debbie.
Maybe I could add that at our executive committee, we had a pretty good discussion about how and what kinds of new members we can get, and Maria was going to follow through with a lot of that stuff. So I'm just really glad that she's in that position where she knows a lot of people in the community, and hopefully we will get some new members. And I think at this point then we're on letter C under information items, and that's the Strategic Review Subcommittee, and it's Laura. I don't know if Laura has any updates.
There are no updates, Madam Chair.
Thank you. This is very strange to do this by phone, so I can't see if anybody has their hand raised, but I'm sure Jody will tell me. D is the TRS subcommittee, and we don't actually have a chair at this point for this committee. We're kind of not active at this point. Jody, I don't know if there are any other updates or anything that you need to add to this.
Yeah, you can see in your the agenda, contracts were prepared and executed for July 1, and so that's been good. Our associate director and contracts administrator, Melody Hanna, has just done a fantastic job in making sure that the contracting process was still underway despite our actual final state and federal allocations didn't come to us until about a week and a half before the end of June, which is a little tough as you're trying to finalize contracts and not having those final numbers to place within the contract themselves. But she did a great job in ensuring that everything else was able to be done in time, that when we did receive our final allocation, we were able to have those contracts executed. Many of our providers were able to turn their contracts around same day or within just a couple of days. And so we are well on our way into this new 2-year contract period. As you know, we did have a contingent vote on 3 providers based on final funding. And of course, that was represented by that potential share, the share of the potential state funding increase. We did a tiny bit of an increase, and so we will be contracting with CarePool, which is the transit agency for cross-county non-medical or non-emergency medical transportation. We are also including Brothers Redevelopment for their high-level case management program, and then also with the Colorado Springs Fire Department for their what's previously known as their CARES program, which is for frequent 911 callers over the age of 60 and others who are other older adults who may be on the track to homelessness. This CSFD case management, high level case management program seeks to ensure people can be safe at home as long as possible. So right up our alley related to our Older Americans Act. So those contracts, those will be coming in the coming days as Melody provides the training and the technical assistance to get those folks entered into our system. Because the allocation came so late, we were just not able to get them in time with the rest of our regular contractors or our previous contractors. So those will be coming, but they are part of this next 2-year contract period. So, Madam Chair, if there are no questions, I'm happy to move on to 6E with the director's report.
Yep, go right ahead.
Great. So thanks so much. So this has been an interesting year related to our funding. We've had both the Older Americans Act rewrite and updates. As you know, we talked not too long ago about how it's at the federal level, there have been these rewrites and rulemaking changes, and there had not been any updates, no significant updates since 1988. And so those have finally come through. They were released this spring. And our state unit on aging, who is our funding and program administrators at the state level, have already begun incorporating those into the policy and procedure at the state level. We have to have all of the new rules implemented by October 1 of 2025. So we have a little over a year to ensure that we're making those changes. So a lot of it is just language changes, some modernization of the language and the procedures, because of, like I said, the last update was 1988. So a lot of updates there. But there are some interesting procedural pieces that we're digging into now. We're now kind of the second phase of that is we're at the tail end of our 5-year contract with the state, and that is directly tied to the reauthorization of the Older Americans Act at the federal level. So reauthorization of each act is part of the ultimate funding process, and because of that, our federal legislators are looking at bills which will provide changes to our funding scenario. Realistically, there are some areas of concern. There's talk of reducing funding in the overall nutrition programs. There's talk of increases in family caregiver support programs, but right now it's all in the planning phases. The reviews have been done in the House. They're now being passed over to the Senate to determine what changes or recommendations might be made. Excuse me. The presidential budget recommendations had some fairly significant increase recommendations. However, those have been trimmed considerably. And so there are still some increases for certain programs, but they're just the tiniest portion of what are the president's budget recommendations were. So there's still a long ways to go in this whole process. At the end of the day, we will use what funds we have to serve as many people as possible. We continually look for opportunities to reduce expenses and ensure that our programs are strong as possible. I had mentioned in the meeting yesterday with our quarterly provider meeting was yesterday, and that's our when we do it in June, July. It's usually our annual contracting training. But I did mention in part of my report that our overall funding is just not keeping up with the needs in our community. In fact, big picture, for those of you who remember going through the TRS process or remember hearing some of the reports, there's effectively a discrepancy between the needs and the actual funding received by about $2.5 million. And $2.5 million is a lot of money, considering that our overall is between $5.5 and $6 million on an average year. And when we really start to break this down, that means there are folks going without meals, there are folks going without transportation, there are folks going without a variety of other support services in order to stay safe and healthy at home as long as possible. And so what we're working on now is a big part of my big push this fall and into the next legislative season will be that legislative outreach to our policymakers to provide background stories, not just the budget picture. You know, data is always good, but data is always supported by the stories, right? And so staff have already been pulling together comments and reports. And I would ask you as members, or those of you who may be on here, even if you're not a RAC member, if you have a direct connection with an older adult who either has received services and it's made a difference in how they can stay at home safely, or longer. Or the opposite is true. If you know of someone who has had to go on a waiting list or has been refused services because of the funding picture, and you have comments of from them, I would love to receive those so that I can build our messaging to our legislators. Many of you, I want to say just a huge thank you to many of you this spring who participated with me in letters and calls and emails to our state legislators. I'm going to be asking you to do that again come our next legislative season. I would also ask that if you would like to join me, if I'm going to Denver, for example, to either sit in on or be on a panel with any of our JBC or Health and Human Services speaking opportunities, if you would like to come with me or join me in Denver, that is an open invitation. You don't have to say a word. Sometimes it's a matter of showing that support by being there in the room and being able to acknowledge that you are there to support additional funding for senior services. And so if I'm going to testify, the word will go out and you would be most welcome to join me for that experience. It is something that we find that we have to make sure that we are advocating for those we serve. And if we don't, who will? And so that's going to be a really big part of my role over this coming year, not just this calendar year, but through the next legislative season, which will go through around April, May of next spring. You'll be hearing more from me. And if you are available to write those letters, send those emails, tell our legislators thank you as we go through the process. I would love to have you join me on that. I will close for now. If you ever have any questions around the process that we go through for all the policy making, the legislative efforts. There's also legislative efforts going on at the federal level. Fortunately, our federal advocates, U.S. Aging, are taking a big part in that and will be providing providing us some opportunities in how to engage at the federal level as well. So more to come. And we just thank you so much for the way that you help us advocate for our community. So, Madam Chair, the only other thing I have under Director's Report is to see if Laura Cruz is on still to share an announcement. And then I see, I believe Melissa has her hand raised, and we'll go to her after Laura.
Hi, all. Can you hear me?
Yes.
Yep.
Yeah.
Okay, awesome. I just wanted to let everybody know that I'm actually leaving PPACG. I just took a job up in Lake County. I'll be the new Director of Human Services there. And so my last day is August 15th. And so I really appreciate working with you guys over the years. It's been a riot and fun and challenging too. So you will be missed, but I will definitely be phoning a friend for certain things for those that are experts in certain ways, but really appreciate your wisdom that you've provided to the programs that we implement here and the providers that we work with. So thanks.
Thanks,
you,
Laura.
so much.
Her dream of moving to the mountains is finally coming true. So we're happy for
Yes.
her, but also sad to see her go. So yeah, thank you. Madam Chair, let's see. Melissa had her hand raised, and then Madam Chair, we'll move on to your report.
Great.
Melissa, you still around?
Thanks, Jody. Yep.
You bet.
Yeah, thanks. I just, again, with Laura leaving, as the mobility coordinator, working on specialized transit and all things that have to do with transportation. She's been such a huge advocate for that. And, looking forward to us getting that position filled, hopefully relatively quickly with the right person. And in the meantime, I just want to remind people that we are bringing on a Vista for the next year, who is he's a college grad coming from the East Coast. He speaks Chinese, and he will be kind of launching into helping to create a mobility training program. And we're going to be doing that without Laura's leadership for a little while. So that's going to be, we're going to really miss her in a very big way, but just letting the folks know on the rack here that we are continuing with interesting innovations around transportation. And for the organizations that are on the call right now who do transportation, thank you for the work you guys do and the collaboration that I know is going to happen when we bring on the new Vista as well. So, take care, Laura. And, even though you'll be here for a little bit longer, but I know you're going to be really missed. So thanks, Jody.
Thanks,
And Jody,
everyone.
And Jody and Melissa, can you give us any, whenever and any information about any kind of leaving celebration or that you're going to do, just please let us know so that those of us who might want to attend can.
Yeah, and we'll be recognizing Laura and Kent at an upcoming all-staff meeting next week. And Kent's retirement party is the 31st, which is next Wednesday. So.
Right. Great. Thank you. And I
You're
just have
welcome.
I just have a couple of things that I would like to talk about as the RAC chair. Jody did a really, really good information about the providers meetings that are quarterly. And I just want to say that I attended the virtual meeting this time, and it was the annual state fiscal year training, which I found really, really interesting. And I just want to say it's a very comprehensive training. And I know that Jody mentioned that our region had a very clean state unit data information stuff. And so I would recommend that anybody that's on that TRS committee, I think, which I will actually be on that committee, I won't be chair, but if you have an opportunity to sit in on one of those quarterly provider meetings, I think you get, a much better flavor of all of the things that our providers have to do, all the hoops that they have to go through and everything that they have to do to continue to be a provider through our area agency. And I think that that's really helpful for people to know and understand when they're actually reviewing all of the proposals that our providers send in. So I would highly recommend that. And the other thing I just want to talk about, or maybe Melissa, you might want to talk about, we're working on, it's the 50th year of Colorado funding. And I know that our area agency is hoping to have a celebration of that. And it's my understanding at this point in time that that's going to occur in September as part of or just after our RAC meeting. So hopefully, the building will be open. We'll have a RAC meeting at the building, and the members who are there can also attend this celebration. Melissa, anything else you want to add to that?
Yeah, thank you for remembering that and bringing that up. Super important. And there's a small planning committee that's working on this, RAC members, just so you know. And we are reaching out to a lot of past participants in the organization. from the Pikes Peak Area Agency on Aging, also reaching out to some people in the community because we're kind of taking a little historical look back over the last 50 years. And so it should be a very interesting meeting and opportunity to honor and look back at some things. So thanks for remembering that, Debbie. As I sit through this meeting today, I have some other things on my mind. And so glad you brought that up. Yep.
Great. Thank you, Melissa. I think that's all that I have for my chair report, except that I hope I never have to do this by phone again. It's just not anywhere near good as seeing people's faces online and being able to see who has a question or whatever. So just to kind of finish up here with our meeting, number 7 is discussion items, and I don't think we have anything for that, Jody. Anything else that you need to add to that?
No, I think, thank you, Madam Chair. I believe everything has been brought up. We've got the retirements and staff moving. And as you mentioned, it is the 50th anniversary of the Old Coloradans Act. And so that is the statute enabled the Area Agency on Aging to be found. And so we're really looking forward to that. Are looking for materials over the next few weeks while we're still there's still construction going on at the office. Please feel free to reach out to a staff member. We did take opportunity before the building was closed to move a lot of our materials upstairs to a new have somewhat access to. So just reach out to us. Don't assume you can't get it. We are also going to be doing a short run of yellow books while the new yellow book is under production. And so if you or your organization are looking for some, please reach out to Laura and Melody and get your count. We'll have a few available, but the new yellow book is under construction, under production, and we expect that out this fall. So really appreciate our staff coming together to make sure that that's coming along. So that's all I have at the moment. Thank you, Madam Chair. And we do hope to be back into the office shortly after Labor Day, and so or around Labor Day. So we'll make sure that announcement gets out.
Great. That was my next question. Thank you.
So the work is on track for what they expected it to look like. The downstairs, some of our leadership took pictures on a walkthrough a week or so ago, and it is just an absolute disaster. It's the ceilings are completely open. This is a big part. It's an air handling project, so our HVAC works great. Our boiler heater system works great, but they don't talk to each other. And so that's really the work. We've been calling it HVAC just to make it simple because, none of us are HVAC and we wouldn't know the difference anyway, right? But that's really what it's technically the air handling process. So it's being computerized. They're running new lines. They're running new duct work. And so it is truly a construction zone right now. So we hope that the goal right now is to be in the office about a week or so after Labor Day. But announcements will come out as soon as the building is reopened to the public.
Great. Thank you, Jody. And the last thing on our agenda here is our meeting schedule. So our next meeting is August 22nd. Hopefully it'll be our last virtual meeting. And then in September, we'll go back to having meetings at the building. I think people will still be able to access the meetings online, but we will still be able then to have our meetings at the building. Our RAC Executive Committee meeting takes place on the first Wednesday of each month, and next time it's August 7th at 11, and it is a virtual meeting. PPACG schedule hasn't changed. So at that, I guess what I would like to call for is the adjournment of our meeting unless anybody else has anything that they want to add.
Thank you, Madam Chair. I don't see hands raised, so I think you're free to adjourn.
Great. Okay. Well, then we'll adjourn. Thank you so much. And sorry I had to be on the phone.